What are you most afraid of? Being hit by a plane, falling off some giant ride in the park, or a snake crushing your ribs? Well, all of them are pretty scary, but the chances of them actually happening are pretty low for an average person. The biggest fear today is not any of these. COVID-19 is the new villain in town, and on the date of uploading this video, the coronavirus has officially infected about 267,013 people, which are confirmed cases. And keep in mind that they are the ones which have been reported, and there can be many more out there who haven't even been reported yet. Although it has a low mortality rate, that is 3.4% estimated by the World Health Organization as of March 3rd, but because it spreads very quickly and as the numbers of infected rises, so does the case fatality. Now it has caused 11,201 confirmed deaths, and cases have been found all over the globe, affecting about 185 countries worldwide. The numbers might increase in the future, but currently they represent the data shown by the World Health Organization website as of March 22nd. What is this deadly coronavirus and why should you even care? Well, first things first, and it's that it can potentially infect anyone on the planet, and that makes it very important for you and me not to become one of those confirmed cases, adding ourselves into the numbers that I just mentioned. Moreover, learning about the nature of the disease and how it spreads can help you assess the risks involved, so that you can use this information to adapt to practical measures that can literally save your own life and the lives of your family, friends, and many others. If you go on the internet, you'll be blown away by the amount of information that is available regarding this infectious disease, and unfortunately, a lot of this information is misleading and is causing more fear and panic among people. Cities that once never slept have been seen desolate and on a lockdown to prevent people from catching the disease. Since a lot about this new strain of virus is still unknown and research is being conducted all over the world in highly sophisticated virology labs, therefore it is under a lot of discussion and debate among general public, and a lot of that discussion includes false information that is unhelpful and can worsen the scenario at hand. So I decided to make this video to shed some light on this matter. I am Aitzaz, and by profession I'm a nursing lecturer, and I made sure that everything that I share about COVID-19 in this video is based on actual facts and current research rather than dogma. And I hope that this video will help reduce a lot of confusion and havoc and expose the misinformation in these discussions, comments, and memes, including fake therapies and treatments with no evidence of efficacy that are roaming around on the internet and social media platforms. A lot of this false information is coming directly from the people who literally have their IQ scores even lower than the room temperature. One should always do one's research on matters like these and only share things when backed up by some competent authority, such as the World Health Organization or the CDC, that is the Center for Disease Control and Prevention. Coronaviruses are a large family of viruses which causes many illnesses in humans and animals. However, in humans, several coronaviruses are known to cause respiratory infections, ranging from common cold or flu to more severe diseases such as severe acute respiratory syndrome, SARS, which affected about 26 countries in 2003 and resulted in 8,000 cases. It was thought to be an animal virus, as from an as yet uncertain animal reservoir, perhaps bats, that spread to other animals such as civet cats. The first infected humans were reported from Guangdong, a province in southern China, in 2002. Later on in the year 2012, the Middle East respiratory syndrome MERS caused by a virus that infected bats, and from those bats it somehow managed to infect camels. Since camels are a very common animal of the Middle East and they are kept near human population, and it is also part of the Middle Eastern culture and lifestyle, it's highly likely that from those camels the virus infected humans. Its cases were first reported in Saudi Arabia, but the virus that is causing the havoc now is none of the above, and it is actually a new genetically mutated strain of the family of coronaviruses. It has been discovered recently, and this one causes the coronavirus disease known as the COVID-19. Now, like all viruses from its family, it has strikingly similar traits, but unlike them, it is much more infectious, spreads very fast, and can potentially put human life on the planet to a halt unless some strict measures are taken by each of us individually. The very first case of this infectious virus was reported to the Chinese World Health Organization country office on the 31st of December 2019. This disease was caused by a previously unknown pathogen called SARS-CoV-2 virus. Soon after the first case, a sudden cluster of new cases started to appear in Wuhan, which is a city in Hubei, a province in China. Since it was a new virus, thus it was named as the 2019 novel coronavirus. It's just like any typical virus, with the genetic material kept safely inside the capsid, and a bunch of binding proteins are located outside the virus's membrane. These proteins help the virus stick to its target sites on the host cell. The structure of the virus looks like as if it is wearing a crown when you take a look at its outer membrane proteins, hence the name corona, which comes from a Latin word meaning crown. The most common symptoms of COVID-19 are fever, tiredness, and cough. Some patients may have aches, pains, and nasal congestion, runny nose, sore throat, and diarrhea. These symptoms are usually mild and begin gradually, Some people become infected but don't develop any symptoms and don't feel unwell at all. Most people, about 80%, recover from the disease without needing special treatment, but around 1 out of every 6 people who gets COVID-19 becomes seriously ill and develops difficulty breathing. Older people and those with underlying medical problems like high blood pressure, heart problems, or diabetes are most likely to develop serious illness. People with fever and cough and difficulty breathing should seek medical attention immediately. If you find yourself experiencing any of these symptoms or you see someone near you having these symptoms that I just mentioned, you must immediately seek medical attention. There are designated hospitals in each province of Pakistan, as you can see in this image, and for your ease I will be sharing a link of this image in the description box below. Well, this is Aitzaz signing off for now. Avoid rumors, do your own research, follow the instructions that I just shared, stay safe and keep others safe too. In this time of need, do your part by doing what you can do individually. What you do makes a difference, because if all of us do what we can do, we can successfully control this pandemic and prevent major loss of both lives and resources. Subscribe to my channel if you haven't already. Go ahead, share this video with your friends and family and help me spread awareness and fight false information and rumors. Also comment and hit thumbs up if you like the message. Till then, eat, live, shine, be happy and healthy, and we will talk soon.